Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Heather, Courtney, and Crystal. So today's episode, we're going to be talking about hyperpigmentation, what types there are, what causes it, and in another episode, we're going to be talking about all the ways we can prevent and treat it. So Heather, let's start off. What is hyperpigmentation?
So hyperpigmentation is really just this excess pigment. Whether it's browns or reds, there are different types that we'll go into, but it pretty much just means more pigment or something that is not your normal skin tone.
Right, and it can happen in any skin type or just darker
Any skin
types?
type, yep.
So we're going to discuss the different types of hyperpigmentation and then where and which populations we typically see it in. Let's dive into some of the most common causes of hyperpigmentation that we encounter in the dermatology office. So Courtney, let's start off.
So we do see a lot of hyperpigmentation, specifically from acne patients who might have spots that are kind of left over, specifically sometimes those cystic bumps that tend to take a long time to heal. Specifically, we'll see them as well for patients who are not wearing sunscreen, which we'll get into later. We tend to see a lot of hyperpigmentation, maybe after, like a treatment sometimes, after rashes. Yeah, all sorts of different skin conditions, melasma being one of them. Again, I know we'll kind of get into the depth of melasma, very common hyperpigmentation that we see. So it can kind of come from any kind of, I guess, inflammation in the skin, whether that be kind of an autoimmune sense or something like a contact dermatitis, different things.
Yeah. So the skin is very sensitive to inflammation, and while it's repairing itself, it can leave behind pigmentation. We call that post-inflammatory hyperpigmentation, and very common, and it manifests in different ways in different skin types. But it's that inflammation that really sets that off. And it can take a while for post-inflammatory hyperpigmentation, or PIH, to fade, especially in darker skin types. We see that a lot with our acne patients, like you mentioned, but we're seeing it, in other conditions. We see it in our lupus patients. We see it in post-surgical cases, where we see some hyperpigmentation associated with that.
PCOS patients, who have extensive hair growth in their chin and, neck area, especially after like years of plucking or shaving or manipulating, or even sometimes those ingrowns can cause that discoloration there.
And even rubbing, constant friction can lead to pigment deposition, lichenification, or thickening of the skin, and you see that hyperpigmentation also manifests. So let's also talk about drug-induced hyperpigmentation, because that's pretty unique. So Heather, talk to us a little bit about it.
Yeah, so I think most commonly we see this with a medication called minocycline, which is an oral antibiotic. And if you use this long term, you can actually get this darkened hue that almost looks blue. So it's very hard to treat. Minocycline is not something that you should be on long term, but that's probably the most common.
So guess what? This happened to me as a teenager.
Oh, gosh.
Yeah, my dermatologist put me on minocycline. I wanted to get my skin cleared up before senior prom. And lo and behold, it was weird. The scars that I had in my skin were starting to turn grayish blue. And I'm like, what is going on? And, it wasn't until derm residency did I realize what that really was. And it took a while for that to go away, but it did eventually go away. But minocycline can be one of those, culprits. But we do see it in other types of medications. So another one that we commonly see is hydroquinone. I mean, Crystal, with your patients with hydroquinone, what do we typically use that for? Brighten up their skin, right?
Pretty much.
Yeah. And then when you use hydroquinone excessively for long periods of time, it can cause something called ochronosis, where you have actually deposition of pigment in the skin and leads to more hyperpigmentation. So it's kind of paradoxical. Like you're treating the hyperpigmentation with this hydroquinone cream, but then in effect, it's becoming darker. And there's actually literally pigment being deposited. Under pathology, it's wild. You can actually see the pigment, these banana bodies, what they call in histology, and it's literally pigment. And those are very difficult cases to treat. We sometimes use lasers to kind of help to mitigate some of that pigment deposition.
I know Courtney uses a lot of hydroquinone, especially before chemical peels, but I've heard her multiple times when she's walking a patient to check out, if they want to refill their hydroquinone and it's been over 3 months, she's always saying, I really got to get you off of that for a little bit because you need what we call a hydroquinone holiday, just to give yourself a little bit of break sometimes.
It's hard. I understand. I mean, they almost become addicted, but yeah, there are times where you do have to take that holiday, switch to something like a lactic acid or kojic acid in that interim, and then you can go back on it because some of these conditions can be a little bit more chronic, like melasma, where we're kind of controlling it rather than, maybe after acne, we've had it controlled. We've controlled the acne. We've stopped the trigger. And then, at that point, we've kind of entered cleanup mode. So,
yeah. And in addition to, hyperpigmentation from like medications like minocycline, which we take systemically, and also with topical medications, there are also medications that make you photosensitive, right? So indirectly, you get more sun exposure, you're more prone to hyperpigmentation. So, there's a lot of different mechanisms in which medications can, make you more sensitive to light. And then also patients who are, immunosuppressed too, they can also be more prone to hyperpigmentation.
some different conditions too that we see. One of them being acanthosis nigricans, and that is when people have an insulin resistance, and so usually these people are pre-diabetic or diabetic and struggling with weight, which can also influence that hyperpigmentation, or struggling with their insulin. So we do see that as a medical condition in the office.
It's very classic on the back of the neck, but you can get it on the front of the neck or on the cheeks and even in the underarms. So I think it's definitely worth addressing that with primary care too.
Absolutely. I mean, many times patients have come to us first and like, hey, I have this darkening of my skin. How do you fix it? And it's really the first time anyone's looking at it. And sometimes we really do prompt them to see their primary care physicians to get further evaluated. And lo and behold, like they're pre-diabetic or diabetic, and that can make a huge impact on your health. So, it's really important to really dive deeper and, optimizing your health, because not only is it affecting your skin, but it's affecting other organs.
Yeah, I never used to see it in kids, but I feel like I see it more in kids now than I do in adults.
We're seeing a lot of childhood obesity, and it is becoming much more prevalent. And we're seeing it in a lot of skin of color populations where they may not have access to healthcare or healthy food options. And, they are starting to develop diabetes at a young age and obesity.
Thank God for Ozempic.
So another category that we often see hyperpigmentation, especially in our clinic, is due to the sun, right? So melasma, yes, you get a condition that you're sensitized and you are, like, light does influence it, but literally just hyperpigmentation, brown spots, age spots, called, freckles or lentigines or ephelids. These are all kind of related to sun exposure, and they can lead to areas of hyperpigmentation. There's a condition called poikiloderma savat, where you have that ruddy kind of brownish red pigmentation, especially on the sides of the neck. So, we treat a lot of sun damage. So, I mean, what else do we see in related to sun damage?
I guess just going back to like the poikiloderma really quickly, the reason that we see it on the sides of the neck is because your chin almost acts as like a physical barrier from the sun. So you don't get that sun exposure on the middle part of your neck. And then kind of going back also to the lentigines, or what people normally call like age spots or sunspots. Some people call them liver spots. And no, it does not mean that your liver is causing those spots. It's just that somebody saw them and it looked like the color of your liver because your liver is brown. And so people started calling them liver spots, but it has nothing to do with your liver.
So in addition to sun damage, we also hear a term often in our clinic called uneven skin tone. So what does that mean to you guys? What do you hear when you hear like uneven skin tone? My patient's coming in for uneven skin tone.
Well, uneven skin tone, it could be, different things for different people. Some people will say that they have certain different colors in different areas. Like they'll say that my forehead is darker than my cheeks, and
it might be more like diffuse kind of all over the face and kind of patchy, or it might be like a couple little spots and very
like blotches.
localized.
Yeah.
Yeah.
And it can present differently on different skin types as well. I mean, for lighter skin types, maybe seeing more of that truly like post-inflammatory erythema after acne, where it's more of a reddish pigment rather than a true like brown pigment. So people might confuse those with acne scars because of that shadowing effect. Whereas in darker skin types after acne, you might see that darkening, more of like that brown or darker black pigment.
Yeah. And, sometimes patients come to me and they say, oh, like the skin on my face and neck and other sun exposed areas are much darker than other parts of my body, and they don't think that's normal. So they're like, I want you to even out my skin tone and make it all uniform. Now, is that actually a medical problem or not?
No.
Yeah.
That's years of sun exposure,
exposure,
baby.
Yeah.
Yeah.
And the interesting thing is many of those populations, especially skin of color, don't think that they need to use any sun protection, so sunscreen, and they're constantly getting exposed. Of course, you're going to have different, shades of your skin color based on that chronic exposure.
Yeah, they think if they're darker, it's like a block, a natural block, and it's not.
Yeah.
Yeah.
I mean, yeah, you have more melanin that can protect you, but you're still getting affected, and it does synthesize more melanin over time. And yeah, we see that a lot. I mean, it's happened to me as well. Playing sports outside. I didn't wear sunscreen when I was younger. And then like my neck and my face were definitely a lot darker than other parts of my sun protected areas, like on my chest or my legs.
Yeah, I think there was a lot of like, and I know we could even create a whole separate show on this, but just a lot of people didn't know back then, and especially skin of color. I feel like there was always this like, just I guess overall like agreement. Well, we don't get skin cancer, we don't burn, so we don't get skin cancer, so we don't need sunscreen. And I'm glad that as we are like moving forward, we are recognizing like, hey, like you still do need sunscreen, and even if you are at a lesser percent of chance of getting skin cancer. Even for some of these cosmetic reasons, which is, I think, equally valid if, that's your, insecurity, or if you're wanting to manage these things. And then again, just, with the potential for skin cancer, I think it's so important.
Like, I won't lie, I didn't start using any sunscreen until about 5 years ago, because that's how I was raised. Like in this Hispanic community, we're raised that you can burn and then it's going to turn over and get a tan, or we just lather ourselves in oil.
Well, and the zinc and the sunscreens were so white on these people of color, so of course there's this aesthetic component too, where I don't want to go out looking like gray and tasty.
Yeah.
Understandably.
Yeah, and the South Asian population too, like it wasn't really a thing. Like there was no concept of wearing sunscreen. We just went outside, we didn't really put anything on, and they just told us not to go out in the middle of the day, so you wouldn't like tan necessarily, but that's about it. There was no talk about prevention or using any sunscreen. I didn't start using sunscreen until I was in residency in my mid-20s. And after learning about how much the sun can damage your skin, I'm like, whoa, I got to really do something about this. And I became very religious about wearing sunscreen daily. And it's just part of my routine, like brushing my teeth, put on my sunscreen. And I think that's contributed to kind of the slower aging process and also optimizing, skin health with everything that I'm doing for my skin. So I don't think that, doing all these procedures and all these treatments are going to do anything if you don't protect your skin. I mean, it's just an investment.
I know there's a lot of people that think that if it's cloudy or like partly cloudy outside that they don't need it either. They're like,
Yeah.
the sun's, but you do.
Depends on the UV index too.
Yeah, but we're constantly getting exposed
Oh,
to
yeah.
UV rays from the sun, even if it's cloudy, raining.
If the sun
snowing.
is up in the sky, it's producing UV. And I used to work with a doctor that used to joke, well, if the sun is really not out, then we have a bigger problem. The sun's out.
Yeah. And then it does penetrate through glass, right?
Mhm.
So you got to be careful. We see time and time again with patients with a lot of sun damage on the left side of their faces because that's their driving side. They're constantly getting exposed to UV light. You have that famous New England Journal of Medicine photo, that trucker, literally his left side of the face looks probably 30 to 40 years older than the other side, like the wrinkles, sun damage, everything. It's such a startling photo to see, but it raises the point like, hey, like you really have to protect your skin.
Yeah, we should have had that up on the screen, but Google truck driver sun damage and you'll see the picture. It's very classic. It is very abrupt, kind of left versus right. And I think it's really interesting too, not only that, but like you were mentioning, just like face and neck exposure. I think, I've seen people come in for their skin exam and originally they're, dressed in clothing covering most of their skin and then they get in a gown and undressed. And I see the difference between their face, neck, and then the rest of their body. And it's really impressive how much of a contrast it can be.
Yeah.
Well, I'm white as white can be. And my parents, my mom's going to listen to this and be like, that's not true, but it is true. She grew up, she's Italian. She didn't really wear a lot of sunscreen growing up. And I think she didn't realize how pale and how much Irish I inherited. And yeah, we would go to the beach and, she'd use the spray sunscreen. Of course, that spray is not getting anywhere on me. It's like drifting off in the wind. So I would get so burnt on beach days. And literally I'm like in the hotel room, like taking a shot, like crying because I'm so cold and hot and burned. So I think even just our like parents' generations didn't know. And I don't know, like I didn't use sunscreen probably till I was 20 or 21. So.
Yeah.
Got that nice chest that I've been trying to laser away.
Yeah, I mean, and it affects other areas that are sun exposed, décolleté, the hands, that can
Shoulders.
Often, yeah. So anywhere where you get sun exposure, it will lead to photoaging, including, hyperpigmentation.
And some of these conditions are even just triggered by sun, but also the heat that's being produced. So some conditions like melasma, for example.
Yeah, and blue light as well.
Blue
Right?
light, exactly. So not only does the sunscreen help protect, especially mineral sunscreen, protect against the light, but also kind of that heat component.
Yeah.
I think there's a misconception that melasma is a hormonal abnormality. I mean, yes, we do see it a lot of times post-pregnancy or if you're on like a birth control pill, but it's really just that those hormones are making you more sensitive to the sun. And most of the time, if we were to check hormones in patients that have melasma, it'll likely all be normal.
Yeah, because a lot of those melanocytes, those pigment-producing cells, actually get excited from the effects of those hormones, and they produce more pigment as a result. And, we definitely see it more often in, skin of color. We see it very commonly in, the Asian, South Asian, Middle Eastern, Hispanic, and African populations because there's just more melanin in their skin. And those triggers can really make it very sensitive. So when you already have melanin in your skin, you've got sun exposure, that's like the recipe to kind of really develop a lot of these, these incidents of the melasma.
I think people don't realize also, you have, especially nowadays, you have so many people working from home and, we touched on the blue light in the windows, but it's really that accumulation that people don't realize. I think they say like your accumulated time in the sun is equivalent to like a day at the beach. Like 1 week is equivalent to like a day at the beach, just like going to the mailbox, driving to the grocery store, walking your dog. I mean, these are all times that, okay, you're saying in your mind, oh, well, I'm only out for a few minutes.
Yeah, or I work from home.
I work from home, but okay, do you go get your mail? Are you, yeah. Are you like in a closet? Like, these times do add up over the course of the day, over the course of the week. So it is really important, even if you feel, oh, well, I'm only out for a few minutes, you know. I don't say that when I brush my, I'm only going out to the grocery store. I don't have to brush.
Yeah.
And then another thing I wanted to point out before we wrap this up is that you can have more than one type of hyperpigmentation. The multiple things going on, and it can be very difficult. I mean, we've had patients who have melasma, also have post-inflammatory hyperpigmentation, and it can be really tricky to treat because you may make one thing better, but the other's not really budging. So sometimes we need to use more than one technique or treatment to really get the results that we're looking for. So I think that segues nicely into our next episode, where we're going to talk about prevention and treatment of hyperpigmentation. So hopefully you guys enjoyed this episode. We talked about the different forms of hyperpigmentation, what causes it, and we're going to dive deeper into how we can treat it. Until next time, Skinside out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.